Thank you for joining us today. I'm Teresa Marintet, CEO of the Windsor-Essex County Health Unit. We will continue to update our website over the weekend, but will not be holding the Facebook live stream over the weekend. We will be back on live on Monday. I will start with our daily updates. We now have 4,043 confirmed cases of COVID-19 in Canada, and 858 of those cases are in Ontario. Chatham-Kent has 2 cases, and Sarnia-Lambton has reported 5 cases. The state of Michigan now has 2,856 cases, with 851 cases in Detroit. To date, we have 9 confirmed cases of COVID-19 in Windsor-Essex. Overall, 669 individuals have been tested for COVID-19, and of those tested, 462 tests are pending. It is important to clarify that pending tests are potential positive cases. Those that are awaiting results are to remain in self-isolation. It is anticipated that wait times for results will decrease next week with the addition of the public health lab in London. Testing for COVID-19 should be based on clinical assessment. All specimens submitted will be tested. Where there are shortages of testing kits, then the following groups will be prioritized for testing: symptomatic healthcare workers and staff who work in healthcare facilities, symptomatic residents in long-term care facilities and retirement homes, hospitalized patients admitted with respiratory symptoms, symptomatic members of remote, isolated, rural, and/or Indigenous communities, and symptomatic travelers identified at a point of entry to Canada. Please continue to visit WECHU.org for the most current information and updated case counts. Travelers who have traveled outside of Canada in the past 14 days are required to self-isolate for 14 days. Any and are feeling unwell and need to seek a health assessment for COVID-19, there are 3 options available. Complete the online self-assessment tool available at ontario.ca, contact Telehealth Ontario, or contact your primary care provider for a phone assessment or a virtual assessment if that option is available. They will guide you for next steps, including contacting public health or attending an assessment center. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for further updates regarding COVID-19.
Good morning, everyone. So now, as Teresa announced, that there are 9 cases in our community. The 6th case that we reported is a female in her 60s with recent travel to Michigan. She developed symptoms on March 18th, went to the COVID-19 Assessment Center on March 23rd, and was admitted to the Regional Hospital on March 24th, where she remains under hospital care. The Windsor-Essex County Health Unit is currently following up with our close contact of case 6, who also traveled to Michigan. The individual developed symptoms on March 18th and was tested at the COVID-19 Assessment Center located at the Regional Hospital. She is currently seeking local medical care with moderate to severe symptoms and is in self-isolation. Case 8 is a male in his 50s that worked at a healthcare facility in Michigan. He developed symptoms on March 21st and was tested at the COVID-19 Assessment Center located at the Regional Hospital. The individual is also recovering at home with mild symptoms and is in self-isolation. The WECHU is currently following with all the close contacts of both the cases. We just got notified about the 9th case. We are still waiting for more details on those cases, and we will update those details as needed, and we'll reach out to all the close contacts in a timely manner to make sure that they're all following the public health directions. All these cases that we are getting in the community is travel outside of the country, and only 1 case who traveled within Ontario. Many of you are wondering about the pending results and its impact on our control measures. So far, almost all except 1 have mild symptoms and currently recovering in home isolation. Having more confirmed cases in the community definitely puts you at a higher risk, but the control measures that are put in place for more than a week now should prevent the spread if and when everyone follows it. Having a confirmed diagnosis is very important for the clinical management of cases in the hospitals, long-term care homes, and in the healthcare worker settings. For most people who are currently self-isolating and waiting for the results, even if their results come back positive, their clinical management will not change. That is why it is important for individuals to have a health assessment done by a clinician to ensure that they do not need any other medical care. From a population health perspective, the measures that are currently in place, such as physical distancing, closure of non-essential businesses, will continue to be effective even in community transmission. It is very, very important for all of us to follow these measures. This is a difficult time, and everyone is going through many challenges in life, and we should not ignore the impact it may have on the physical and mental well-being of our community and our individual. There's a lot of stress and anxiety everywhere, and it's not good for our overall health. To help reduce the stress, it is important to focus on what is in your control and follow those key steps. Create and keep routine. It will help you to stay focused and motivated to do things at home, whether you're working from home or just self-isolating. Number 2, stay up to date with accurate information. There are a lot of misinformation going on. Social media is not helping anyone. Use credible sources to get your accurate information. There is no conspiracy going on. This is a real threat, and we must do everything to our part instead of focusing on what others should do. Acknowledge and talk about your feelings. We use the term social distancing, which is more about physical distancing. Social distancing or physical distancing, we can still maintain our physical distance, but we still have to talk to people. Talk to your loved ones. Spend time with your family. Talk to your children, how they are feeling. Tell them how you are feeling. Help them understand what's going on in the world. Get outside, even if it's only in your backyard. The outdoors and fresh air are incredibly important for our mental health. If you can bike or run outside, it is great. Please make sure you're maintaining your physical distancing when you're out. Do not touch your mouth, nose, and eyes when you're outside. Wash hands immediately when you return home. While isolation and maintaining physical distance is important to fight against COVID-19, it can have detrimental impacts on our mental health. We have to start thinking of innovative ways to stay connected to each other to ensure that we can sustain a mentally healthy community throughout this crisis. What does social prescribing look like in this new age of social distancing is the question we should be trying to answer. All of us are in this together, and we must work together to prevent the spread of COVID-19 in our community. Thank you.
We'll now take questions from the
patient in the hospital. How does that change things at all in terms of protocol at the hospital? Does it change anything? Can you speak to that?
Well, if someone is in the hospital, so that means they are needing medical care, which could be important from the clinical management of that case. And from a hospital perspective, obviously ensuring that this person is under isolation and following all this personal protective equipment protocol that they need to, and making sure that this person, if needed, to require critical care, require intensive care, they can be provided with that care. It does escalate the risk for that individual, but from a community perspective, the community risk stays the same. And anyone who is in self-isolation, if their symptoms worsen, it is time for them to contact their healthcare provider, talk to the public health to see if they require any further assessment. Most people who are infected with COVID-19 have mild symptoms, and this is the case around the world. Most of them would not require any medical care other than just self-isolating and symptomatic management. So from that perspective, for the community, it still stays the same. For that particular individual, their hospital needs or their clinical needs are met at the hospital.